I'm Brian Ellis. I'm a family physician here at Danville Family Physicians, and I have been with Ephraim for over 20 years, and I've been in Danville for 28 years. Probably the biggest challenge is actually just getting men to come in to the doctor. We are not usually very accessible to that, so we tend to stay away and minimize things. So actually getting men to come in and just deal with problems and do preventative care is always a challenge. Risk with not coming in really are just that things can get worse before they're found, before they're acknowledged. So, for instance, the old folks would call high blood pressure the silent killer, just because it really doesn't give symptoms. So if men are at risk for that and they don't get their blood pressure checked, they don't go see a physician, then there can be damage before it's treated appropriately. That's just one example. Well, I think that the first thing they should do is get a primary care provider and get an appointment to go in and sort of get things checked. And then how often they have to come after that really depends on their problems. Some things we want to keep a very close eye on, such as diabetes and high blood pressure. And if everything looks good and there's really no problems, then once a year is probably sufficient. Oh, well, that's a long list. Lots of things that could be a problem and that they should be seen. I would say one thing is if just something's different. If they notice that, hey, I used to be able to do a specific amount of work and now I can no longer do that. Now I'm getting trouble with shortness of breath or chest pain or my heart's racing, things like that. And I would say definitely you want to be checked. But that list can be very long. And so if things are changing, if something's different, then I would say it would be a good idea to be seen and discuss that with your provider. Everything seems to go in the wrong direction when we get older. So blood pressure goes up, cholesterol goes up, blood sugar control can get worse. So those sorts of things just need to be monitored. And also it's particularly important to know a family history. And those things need to be discussed and looked for with just logical preventative care. The basics: you want to get your blood pressure checked, you want to get your cholesterol checked, you want to make sure that your sugar is under good control. Some fasting screening blood work is a good idea. You want to check for colon cancer. The age for that is at least by 50 years old. Some insurances are paying for that a little bit younger, now at 45 years old. And if you have a family history, it should be even younger than that. So colon cancer screening, blood pressure screening, cholesterol screening, diabetic screening, those sorts of things are just important to get checked. I think that perhaps the biggest challenge for most men as they enter middle age particularly is to stay active. What happens to so many of us is that we have jobs that are more mentally taxing and they're not so physically taxing as we get older. And so to make sure that we're keeping our weight down, that we're actually exercising regularly, really can make all the difference in the world. And of course, we really haven't even talked about smoking, but for men that are smokers, I would say that's the number one thing, is to stop smoking. But it's very hard to quit. So I would say getting off cigarettes, talking to your provider about ways to help quit smoking is very important. Well, sure, yes, there are. And the one right now that is in all the news that we talk about constantly around here is getting the COVID vaccine. And I'm a big proponent of that. I think it should be something that everybody gets. I trust the vaccine way more than I trust the virus. And I really think that is our option. I'm concerned that those of us who do not get vaccinated are going to end up getting the virus. And the risks of the virus are significantly higher than any risks with the vaccine. So the first thing I would say is get your COVID vaccine. I think it's very important to get yearly flu shots. I think it's important if you haven't had one and if you're over the age of 50, I think you should get shingles vaccines. That's actually a series of 2. Then as we get older, there are other vaccines that we should add to that. Pneumonia shots are something that we want to do after the age of 65. So again, there's a long list of those things, and I think that should be discussed with your provider.